We've all been there, right? You're outside, just enjoying the day, and then you feel it. That sudden pinch, a sharp sting, or that itch you just can't ignore. And in that split second, your brain just floods with questions. What was that? Is this bad? And what on earth am I supposed to do now?
Well, let's dive right into that moment. We're going to walk through everything, from the best ways to keep from getting bitten in the first place, all the way to spotting those serious red flags that mean you need to get help fast.
So, first things first, let's meet the usual suspects. Because, understanding what they're after and how they operate, that's really the key to knowing how to handle the whole situation. Now, notice the huge difference right here on this chart. For guys like ticks and mosquitoes, the big worry is disease. They bite you and they can pass on something nasty. But for bees and wasps, it's a totally different ballgame. The danger isn't disease, it's the risk of a massive allergic reaction, what we call anaphylaxis, from their sting. And this difference? It's everything. A bite is basically for lunch. They're trying to get a blood meal. A sting, though? That's a weapon. It's pure defense and it injects venom. And it's that venom that causes all that immediate pain, and for some unlucky people can kick off a life-threatening reaction. All right, so how do we avoid this whole mess in the first place? Let's get into the prevention playbook. Because honestly, the best way to treat a bug bite is to just not get one to begin with.
Okay, when it comes to ticks, remember this. They don't fly. They don't jump. They're climbers. They wait on a piece of grass and just grab on when you walk by. That's why these simple physical tricks are so effective. Light-colored clothes let you see them, and tucking your pants into your socks is like putting up a wall. But the number one most important step, that full body check as soon as you get back inside. Don't skip it. Now, if you're using repellents, especially with kids, the details really, really matter. DEET and Icomerdin both work great against mosquitoes and ticks, but look at the concentration. For kids, you want to stick to 10% DET or less. With Icomerdin, you've got a little more leeway. You can go up to 20% for anyone over 6 months old. So what if you find one? Okay, deep breath. Getting it out the right way is critical. The technique is everything. You need fine-tipped tweezers. Get them as close to the skin as you possibly can to grab the head. Then pull straight up, slow and steady. Whatever you do, don't twist it, don't jerk it. You could break off the mouth parts in your skin. And after it's out, give the area a really good cleaning with soap and water.
Okay, so your prevention plan didn't quite work and you've been hit. Don't panic. Here's exactly what you need to do in those first critical minutes. These are the fundamentals, your go-to moves for most run-of-the-mill bites and stings. Number 1, wash it. You want to prevent any kind of infection. Number 2, get some ice on there. It'll help with the pain and keep the swelling down. And number 3, if it's really bugging you, a simple pain reliever like acetaminophen is your friend. Now, with a bee sting, time is of the essence because that little stinger it leaves behind, it's a tiny pump that just keeps injecting venom. But how you get it out is what's most important. Do not grab it with tweezers. You'll just squeeze the venom sac like a juice box. Instead, you scrape it out. Take a credit card, a key, even your fingernail, and scrape it sideways. Just remember, scrape, don't squeeze. All right, now for the really important part. When does a simple bite stop being, well, simple? Most of the time, they're just annoying. But you absolutely have to know how to spot the signs that something much more serious is going on. It is so easy to see a rash and just dismiss it. Oh, it's just a little skin irritation. But in the case of a tick bite, the kind of rash you see can be the very first and sometimes only clue that you're dealing with a real infection. And knowing the difference here is vital. A normal little reaction to a bite happens fast, within a day. It's small and it goes away pretty quickly. The rash that screams Lyme disease is the exact opposite. It's delayed. It might not show up for days or even weeks. It gets bigger and bigger past 5 centimeters, and yeah, it might have that classic bullseye shape. If you see a rash that is actively growing, that is your signal. Go see a doctor. And this is why catching it early is such a big deal. Because if you don't treat it, that Lyme infection doesn't just stay put. Over months, it can spread throughout your body. We're talking about it getting into your heart, your joints, your entire nervous system. Early treatment with antibiotics is everything. So beyond diseases from ticks, that other huge red flag is a severe allergic reaction. And just to be really clear about the stakes here, a quote from the source material puts it bluntly. When these things turn fatal, it's almost always because of anaphylaxis. So what does that even look like? The key thing to understand about anaphylaxis is it's a whole body crisis. It's not just a bad rash. You're looking for symptoms happening in different body systems all at the same time. Think trouble breathing, plus stomach cramps and nausea, plus breaking out in hives all over. Let me be absolutely crystal clear on this. There's no gray area. If you even suspect anaphylaxis, it is a medical emergency. The only correct response is to use an epinephrine autoinjector immediately and call for help. Do not wait. Do not wonder if it'll get better. Act. So let's boil this all down, right? Your takeaway playbook is just 3 simple steps. First, prevent. Do everything you can to avoid the bite in the first place. Second, act. If you do get bit or stung, use the right first aid right away. And third, watch. Keep a close eye on the site, looking for those red flags, a rash that's getting bigger, or any of those whole body symptoms. And that leaves us with one last thing to think about. We know the climate is warming up. We know tick seasons are getting longer and their territories are expanding. This isn't a problem that's just going away. So as we get better at all this, the prevention, the treatment, maybe the bigger question we have to ask ourselves is how we learn to safely coexist.